Hello and welcome again to another Conversations with Dr. Westman. Today we're going to be talking about how the keto diet will change your life. Whether you're just looking to lose weight or you have a secondary condition such as type 2 diabetes, metabolic syndrome, pre-diabetes, the keto diet may be exactly what you need. We also have a special bonus for you today, which is Dr. Westman's brand new quiz. We'll tell you a little bit more about this at the end of today's episode, and we'll also put a link for you in the description. So let's get started. How are you doing, Eric?
Doing great. How are you, Glenn?
Very good, thank you. So today we're going to be talking about how the keto diet changes lives. You've been advocating a keto diet in your clinic for over 15 years now. How has your method of keto changed your patients' lives over the years?
Well, in so many different ways. Where do I begin? I mean, how much time do we have? We often focus on the medical problems getting better. So we do a lot of talks about the diabetes and obesity and heartburn and PCOS and all that, but that just scratches the surface. I mean, now any kind of program that helps people get rid of hunger rather effortlessly, any program that allows people to eat great foods and then leads to weight loss or weight maintenance. I mean, these change people's lives in many different ways beyond the medical realm, but definitely the medical problems get better. It's in fact so obvious to me now that these medications are treating the bad lifestyle, meaning diet and activity, stress, all that is out of whack. And so doctors use medications for that. So for sure, the medical problems get better. That'll change your life.
So often I've heard you say that nutrition is more powerful than taking a prescription medication. How so?
Absolutely. Well, if you just line up all of the medications that I can take away from someone by changing their lifestyle, using a keto diet is what I do, a carb restricted diet, I could take away 10 medicines from people as they start changing their lifestyle. So that tells me that it's as powerful in some people as 10 medicines.
And so how long typically does it take for your patients to start feeling the initial benefits of the diet?
Well, the hunger goes away in just a day or two. If you're trying to do something to help you with hunger or cravings or weight loss, that's really pretty fast. And it's remarkable because people will lament often what am I going to do without my bread and my fruit? And, I've had it all every day. Well, those cravings go away remarkably fast. So what you notice when you get to a healthier way of eating, and really that's all I talk about at first. I don't need exercise to help people have dramatic changes in their life, which often is mystifying to people because they've been taught that they have to exercise, but you don't. So diet is so important. The effects are very quick.
Now, we also know that there are many, many more powerful benefits of eating, for eating this way, besides the initial hunger and cravings going away. How long might it take for people on their medications to work with their doctors? And it is very important to mention that they should work with their doctors to be able to wean off their meds. And how do you know when the right time, to do this is?
Right. Well, and that's an important point, that if you're taking medications, you're being treated for a medical problem, you want to be sure that you're getting supervision to be able to get off the medication safely. It can be as fast as on the first day, I need to reduce diabetes medicines to avoid a low blood sugar. And that depends on how controlled someone is, how tightly controlled or loosely controlled. But I typically see a 50 to 100 point drop in the glucose level, and that's in milligrams per deciliter. So that's going to be a 10 to 15 in millimole drop on the first day of the blood glucose. And so if I don't instruct people and tell them to watch out and be sure to keep measuring the blood sugar, it can go too low. So that's the most dramatic change that can happen. Other medicines that take a little longer but still are remarkable to be able to take people off them, are the blood pressure medicines, the heartburn medicines, the arthritis medicines. And the way you take them away is kind of like just the reverse of how you started medicine. So let's say you were using a blood pressure medicine when the high number was at 130 repeatedly. Well, when the high number comes down to 120, 110 repeatedly, then you start tapering back the medication. For a blood glucose, if you added a medicine when the blood glucose was, say, 110, 120, then just when you hit that point as you're coming down, you start reducing the medicine, kind of reversing the way the medicine was given. You take it away in that same sort of way. It's not difficult to learn, but most doctors just have never ever done it. So they don't expect that that's going to happen. And I expect that to happen.
That's very important that folks work with their doctors when it comes to adjusting medications. This is definitely not something that you want to do on your own, right?
Well, that's if you have medical issues. I mean, I've treated so many different people, and we've started to treat people through digital classes, and others have done that for years now. And I'm comfortable changing the food, if this is just changing the food, in people who don't have medical problems, they're not on medications, without that kind of medical supervision. So you don't need medical supervision unless you have a medical problem, is I guess a way to think of it.
Now, we also know that there are so many different approaches to diet, and your teaching is solely based on the science and the literature. Why would you say that your keto method is easiest to sustain long-term, and what exactly is internet keto?
Well, the method that we've used has been around 150 years. So we know the long-term effects of it. And that's why I can be confident. I mean, I've used it for 15 in my practice, 20 years, and if you count the clinical research that we did here at Duke. So the proof, is how long someone is able to sustain it. And I've seen people sustain it for that period of time. So evidence-based keto is what was used in the studies by all the different investigators around the world, versus what's being taught or learned on the internet today. And probably the biggest internet thing that, it's a double-edged sword. It's great that the popularity has gone way up, but it's not so great that people feel like they have to buy products to do a keto diet. So that's probably the number one thing, is that people think they have to buy this product. And so in my clinic, I see people coming in, oh, it's getting too expensive. And I say, well, what are you doing? Doesn't have to be expensive. And they're telling me all the products and pills and supplements and things that they're taking because they think that is what keto means. And that's one way to do it. It works for some people, but keto really means that you're burning fat. And if you're trying to lose fat weight or treat diabetes, you want to burn your body fat. And actually your ketones come from the body fat burning from within. So you don't have to buy products or pills or all these ketone things that are out there for sale. That's probably the number one misunderstanding of what keto internet-based versus keto evidence-based, which is a food-based sort of program.
And lastly, Eric, what sort of success can people expect to get if they implement your method?
Well, it's important to be all in. It's important to do it strictly, however you want to say that. Like a prescription drug, if you follow this, it will work, right? So if a doctor prescribes you a pill, you don't say, well, maybe I'll take it half the time. You do what the prescription says. So if you follow this every day and the cravings go away in a day or two, if you have weight loss to happen, that's what you want, then it's 1 to 2 pounds per week is what I typically see averaged over a month. So it's not a direct linear thing. So it's 4 to 8 pounds per month, 50 to 100 pounds per year. I can get most people off of insulin within 2 to 4 weeks, sometimes even in a day. So the results from the medical side are really pretty astounding. But I just have to comment that it's I got my life back. I'm walking up hiking up the trail that I thought I'd never be on. I'm playing with my grandkids. I mean, those are the stories that, as we saw in the ADAPT events, that are just so heartwarming and life-changing. That not just the medical issues, but all the other things people are able to do.
Well, that's fantastic, Eric. Well, thank you so much. That's all we have time for today. But before we leave, reminder that we have a special bonus for you today, and that is a brand new quiz that we have created for you guys. It's based on Dr. Westman's book, End Your Carb Confusion. And if you haven't read the book and you'd like to determine your own personal carb threshold and how to customize your own carb intake, then this quiz is definitely for you. We'll put a link for you in the description. And if you'd like to learn more about our upcoming online courses, you can find us at adaptlifeacademy.com. Eric, thank you so much for being with us today. And we look forward to catching up with you next week on another interesting topic on Conversations with Dr. Westman.
Thank you, Glenn.
Thank you so much.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.